Hello everyone, this is Doc ID. Today we're going to talk about COVID-19 as the leading cause of death in the United States. This article came out in JAMA in December of 2020. These authors compared COVID-19 related mortality rates with the leading causes of death in the US, which is heart disease and neoplasms. They used data from the CDC and prevention and showed mortality rates per million during the period of March through October of 2018 with COVID-19 mortality rates during March through October of 2020. The daily US mortality rate during March through October for COVID-19 deaths was equivalent to the 9/11 attacks, which claimed 2,988 lives, or you could think of it as occurring every 1.5 days, or maybe like 15 Airbus 320 jetliners, each carrying 150 passengers, crashing every day. It's a little dramatic, but those are the numbers. Let's go to this table. It includes the three leading causes of death: COVID, heart disease, and neoplasms. By October 2020, COVID-19 had become the third leading cause of death for persons aged 45 through 84 years and the second leading cause of death for those aged 85 years or older. Adults 45 years or older were more likely to die from COVID-19 during those months than from chronic lower respiratory disease, motor vehicle fatalities, drug overdoses, suicide, and homicide. So this threat from COVID-19 may be even greater for three reasons. First reason, this table presents the aggregate 8-month mortality rate for COVID-19, not the current mortality rate, which has been increasing rapidly. Between November the 1st and December the 13th, the 7-day moving average for daily COVID-19 deaths tripled from 826 to 2,430 deaths per day. And if this trend continues, it will soon surpass the daily rate that we saw in the spring of 2020, which was 2,856 deaths per day on April the 21st, 2020. As occurred in the spring, COVID-19 has become the leading cause of death in the US. Daily mortality rates for heart disease and cancer, which have been the two leading causes of death, are approximately 1,700 and 1,600 deaths per day, respectively, with COVID-19 mortality rates now exceeding these thresholds. Second reason, the reported number of COVID-19 deaths underestimates the excess deaths produced by the pandemic, secondary to reporting delays and miscoding of COVID-19 deaths, and an increase in non-COVID-19 deaths caused by disruptions produced by the pandemic. Lastly, COVID-19 is unlike other causes of death because it is communicable. People who die from homicide or cancer do not transmit the risk of morbidity or mortality, versus every COVID-19 death signals the possibility of more deaths among close contacts. So what does this mean? COVID-19 ranks as a leading cause of death. At certain times, it is the leading cause of death. Compared with leading causes of death from the same period in 2018, COVID-19 was the third leading cause of death for children and adults, 698 deaths per million, ranking only behind heart disease, which was 1,287 deaths per million, and cancer, 1,219 deaths per million. No age group has been spared. Authors had predicted that the rapidly rising death rates this fall will exceed spring death rates when COVID-19 was the leading cause of death. Here's another slide from NCHS, National Center for Health Statistics, of all deaths involving COVID-19. It is kind of interesting. You can see the beginning, how it started, and then had that peak during the springtime, and then eventually came down a little bit, the numbers, and then you can see it kind of gradually went up again October, November, and December. And you can see between November 1st and December 8th, the 7-day average for daily COVID-19 deaths nearly tripled, 826 to 2,226 deaths per day. Daily deaths in the first 13 days of December averaged 2,381 deaths per day. On December 9th, a record high of 3,411 occurred, more than 2 deaths per minute. Such numbers elevate COVID-19 as a cause of death higher than heart disease and cancer. Cumulative COVID-19 deaths in the US has surpassed 400,000. The US constitutes 4% of the globe's population, ranks first in the world in total pandemic deaths, 19% of the global total, and it is the 12th worst COVID-19 cumulative mortality rates of all countries. The rising deaths have become despite heroic efforts by our frontline healthcare professionals, advances in hospital-based COVID-19 care, and therapeutic agents such as monoclonal antibody tests, remdesivir, and dexamethasone. Notably, mortality rate statistics fail to capture the full devastation of COVID-19 related morbidity involving not only physical health but also the emotional, social, and spiritual dimensions of well-being. Risk of COVID-19 death is highest among the oldest and lowest among the youngest population. People between the ages of 75 and 84 years and those 85 years or older have 200 times and 630 times greater average death rates respectively. Nursing home and long-term care facility residents and staff are at high risk, representing only 5% of the population but 38% of the deaths. Lastly, COVID-19 will further prolong stagnant US life expectancy trends. In earlier research, that while US life expectancy increased rapidly in the 70s, advanced a little bit more slowly in the 80s, peaked out in 2014, and then started to decline annually for the next 3 years. This current study results suggest that COVID-19 will only worsen this trend, especially because excess 2020 US mortality has resulted not only from infection, but also from conditions such as heart disease and Alzheimer's disease that possibly went undetected or untreated during the pandemic. So we really need to fight this battle together and work as a nation to end this life-debilitating period of our lives. Getting vaccinated and creating that herd immunity, please check my previous video, is important. My next topic will be about the shingles vaccine, which will be also very interesting. So please don't forget to subscribe and comment below.